All right, now we're going to move to the next part of our session, the climate crisis through the eyes of healthcare professionals, a collection of pictures, poems, drawings, and videos. And we're going to have Dr. Gina Friel come forward, Dr. Michelle DePhillips, and Dr. I'm going to mess your name up, bro, Gaurav Basu.
Awesome, thank you. I'm staying here, so you get to hear a little bit more of me. Sorry about that. So I am the director of the Global Consortium on Climate and Health Education. My name is Cecilia Sorensen, and I'm joined today by some incredible colleagues. Why don't you guys introduce yourselves?
My name is Gaurav Basu. I'm a primary care doctor and the director of education policy at Harvard C-Change.
Hi, my name is Michelle DePhillips. I'm a nursing professor at the University of Delaware, and I'm the GCCHE Nursing Fellow.
Hi, everyone. Good morning. I'm Dr. Gina Friel. I'm a pediatric nurse practitioner in Annapolis, Maryland, and I am the previous nursing fellow with the Global Consortium with CC and Michelle.
Thank you so much. And thanks to all of you for being here. So the Global Consortium on Climate and Health Education was founded in 2017 for the sole purpose of ensuring that every health professional globally has the knowledge and skills to prevent, prepare, and respond to climate and health impacts in their communities. And we have an incredible consortium of over 350 health professional training institutions from over 60 countries, as well as nearly 200 NGO and governmental organizations and over 5,000 individual members. So when we were coming to COP and we wanted to share some stories of the GCCHE, we actually reached out to our consortium and we said, send us your stories, send us your thoughts from the front lines. And we really had no idea what we were gonna get. And it was kind of fun. And so we got a lot of submissions, and we're here today to share with you these pieces of art, these pieces of poetry, these stories from health professionals, from their communities. And I think what this really does is really bring the personal story to climate and health. So with that, we are going to dive in. We've got about 13 different submissions that we chose to share with you, and we hope you enjoy them. So over to you.
Okay. So this one resonated a lot. I'm Bengali and think a lot about West Bengal, India, and my ancestry as well when I think about climate change. So this is from Wasim Akram, a medical student from India who wrote a poem that we were struck by. Global climate change makes us think a lot. Climate change is surely causing environmental pollution, and the effects of climate change are being felt in nature. The Sundarbans, which is a beautiful place, of West Bengal, is home to the Royal Bengal tiger. The greenery, the trees of the Sundarban, the lungs of Kolkata are being damaged to meet humans' needs. This reduces the amount of oxygen that is produced and the amount of carbon dioxide in the air. The lives of the Royal Bengal tiger, a precious part of our heritage, are under threat. Today's scenario, the Bengal tiger is looking for greenery, wanting to get out of prison-bound frame because he can't live there. If things continue as they are, the Royal Bengal tiger species will be lost from Earth. I need green, give us green, keep it green.
The next submission is by an environmental health professional from Malawi. Manfred Malimia. Global warming. A relative rise in the global temperature linked to heated balloon, air exited through a puncture. Experienced across the earth as olden life centered on the hearth. Carbon emissions into the atmosphere in industrial revolution posing fear. And its continuum mostly by industrialized nations forming atmospheric blanket against global radiation. Climatic changes being encountered, crop production ineffective being rendered. As floods, droughts, and famine are imminent, for no remedy available for their complete treatment. In operation are mitigation measures for protection of these natural treasures and subsequent quitting of disasters ever witnessed by our ancestors.
You can go to the next slide, please.
This submission is from Justin Lee Austin, who's a medical doctor from Trinidad and Tobago. This image here and this poem are both reflective of the kind of increase in extreme weather events that are occurring in the Caribbean. And it really also reflects on the unwavering commitment of healthcare professionals to their patients. Sun beats, healers tread. Through hurricanes, fearsome spread. Hands soothe, fears are shed.
The next submission we received was from Jonathan Vincent dos Santos Vieira, who is a global mental health and climate researcher from Brazil. He writes from Sao Paulo, November 14th, 2023. Dear future, as I sit down to write this letter, my heart is heavy with the burden of witnessing the alarming consequences of climate change unfolding in Brazil and other low middle income countries. The mercury keeps rising, reaching degrees of a staggering 47 degrees Celsius. I write this to draw attention to the profound and heartbreaking impact that climate change is having on healthcare everywhere. Unfortunately, our sincere efforts have been met with political inertia, a reality that highlights the severity of the situation we face. As a dedicated researcher and a member of the Latin American Global Climate Health Alliance, I can attest to the tireless efforts we have invested. I am unshakable.
I'll speak to Jessica Linens, who is from Peru and is the president of the Miraflores Rotary Club. So she had these two imageries that she offered us to leave your mark and save the planet, and again showing our polar bear and a melting planet. And then Carlos, her.
I'll do that.
Okay.
The image to the right was, I believe it's a painting by Carlos Hernandez, who is an emergency medicine physician from Mexico City. He writes, a medida que avanzan los veranos, el calor abruma en la Ciudad de México y inunda nuestros hospitales. Es implacable. El calor mata en la Ciudad de Mexico. As the summers progress, the heat overwhelms Mexico City and overruns our hospitals. It is unrelenting. The heat kills in Mexico City.
I'm going to read a poem that was submitted by Normaka Uzana, who is a veterinarian from Nigeria. This poem is titled In Sync, and it is about the migration and invasion of vectors. She flies undeterred. Zones once forbidden welcome her home. She feasts her eyes on new horizons. What is this place? Could it be the place Mama told us many flight years ago? Mama said it's so cold out there you can't survive. But it's so warm and cozy now. So she flies undeterred, wings beating a joyous rhythm of excitement as she revels in the thought of new conquests, perfecting her battle plans with each stroke. As she flies undeterred, her nasty tenants dance in infectious glee. How wonderful to move house. We can't wait to meet our hosts, they quip. Their elated chatter fills with a new sense of urgency. Fueled by frenzied anticipation, she dives down to meet her unsuspecting hosts. She is not alone. The swarm, too, is undeterred.
We'll go to the next slide, please. These photos on the right of the screen were submitted by Nadia Noreen, who is a medical doctor from Pakistan. She wrote that the smog issue in Lahore and many other cities is worsening, and this issue returns every winter with greater intensity. She notes that major contributing factors are immense traffic pollution, crop burning, and industrialization.
Okay, this is Diamond Spratling, who's the founder and executive director of Girl Plus Environment in the United States, who and is a public health professional. So, Toxins in the Wind, a childhood in Detroit. In Detroit's embrace, my childhood spun, streets on the west side, endless fun. With friends we'd roam in innocent tread, outdoor games, the laughter we spread. Yet as a child, I failed to see the air we breathed, a silent decree. Unaware pollution, a silent tide, Innocence masks what toxins hide. Outside I played, just a kid so free, not realizing what it cost my family and me. Toxins lurking in the air, from factories' breath, a silent snare. Uncles toiled at the Ford's plant's heart, providing, striving, playing their part. Yet dollars earned, a double-edged sword, toxic wages, a heavy reward. Food on the table, clothes on my back, but toxins whispered an insidious attack. Health conditions born from the air, asthma, stroke, a silent despair. The motor city, my love so true, yet beneath the surface a darker hue. Physical and emotional scars it bore on me and mine forevermore. I was just a child, innocent and small, playing after school, unaware of it all. In Detroit's heartbeat, joy and strife, a tale of innocence, a city's life.
Next slide, please.
So these images were submitted by Emmanuel Auguste, who is a medical doctor from Haiti. And this medical doctor commented, "The storms repeatedly batter my country, and we try to save people, but it feels that we are disappearing."
And the part of the presentation right now is around a healer's wounds. And it took us a moment when we were looking at this image, but this is a medical professional who is kind of turned into dust in some ways. You'd like to go to the next slide?
My name is Wakegara Nightingale, and I'm a registered nurse from Kenya, born and raised in the Rift Valley, the cradle of mankind, and I'm here to tell my climate story. I just recently lost my aunt to COPD, and she's not even buried yet. It is a sad story, and it's not just a story of me and my aunt. It's a story of many other women who've been exposed to these issues related to climate change, related to smoke, it's respiratory issues, among other issues. And I want to tell this story so that it can be shared and we can hear the stories of other people out there who are experiencing similar challenges as we come together with solutions. My community, in the nurses, the healthcare workers, the elders, together with the children of the community, are coming together to discuss and to see how can we reduce this impact? How can we adapt? How can we be resilient? And so we're really integrating indigenous knowledge that has been there for millennia, together with the knowledge that we have now on health, to really heal, to work on healing ourselves, to work on bringing in the change and bringing in the solution. So please join me as we tell these stories. We cry together, but also laugh together as we come up with the solutions.
We also received many submissions in a series we call Healing Our Wounds. And I thought it was really inspirational that we got submissions about pictures of education and training that are happening throughout our networks throughout the world. So the photos that we see on the right-hand side of the screen here were submitted by Tom Rogers Muyunga Mukasa, who's the CEO of Advocacy Network Africa. And what he wrote was this: "We work in agro-based communities. The climate affects the way our beneficiaries lead their lives. For instance, over a wide area in Africa, the rains are no longer predictable as it was many years ago. People rely on the rains for agricultural produce. Low harvests have been registered, and with that, food loss and poor household level nutrition, which affects one's immunity and resilience. The weather patterns have changed, and with them, epidemics. As far as healthcare delivery, it affects strategic mobilization of communities to access health care, education, and health services unless there are food rations to be provided to the people. It also affects the mobility of communities because many who are animal grazers now follow the animals where there is green pasture. This has led to clashes with several other communities, raising issues of resource use. We cannot concentrate on providing healthcare services when political and civil unrest gets in the way. The messaging around healthcare during emergencies is affected too, and people cannot be fully and meaningfully engaged. We work with people living with HIV, and due to climate change, we are noticing patterns leading to poor adherence practices. As temperature rises, the food crisis, the heat waves, and the rain that pour and become floods, which damage the roads, affect the way we deliver our services. We are forced to keep the urban centers and neglect the other non-urban, non-built infrastructure communities. But not all is lost. We are building partnerships with national and international organizations such as the Red Cross Crescent to pool together. It is such networks and partnerships that have enabled a reenactment and redesigning of resilient mediated solutions and countermeasures, empowering frontline health workers to continue working during the crisis, pandemics, and cataclysms is one way of establishing intuitive and catalytic innovations. The next submission we received about education and training was from Dr. Purvi Patel, who is a senior health consultant from India. And that is the photo given right there. She writes, "When I graduated from medical school in 2005, climate change had not yet entered the realm of public health. Although I had been observing the Indian monsoon becoming increasingly unpredictable and experiencing frequent heat waves since the 1990s in the part of India where I was born, health impacts of climate change did not seem to be at the forefront of collective consciousness till the 2010s. I believe it is one of the few instances in history of medicine where a risk factor is recognized as an emerging health threat by public health before it is recognized by clinical medicine. There lies the challenge of integrating climate change into medical education and clinical medicine, and it is further compounded by the need for urgent action collectively in the health sector and individually as health professionals. As a public health professional, I have been working with India's National Program on Climate Change and Human Health, the National Center for Disease Control, under the Ministry of Health and Family Welfare. It has given me a unique opportunity to comprehend the health impacts of climate change in my country and be instrumental in strengthening the health sector response. My work is part of India's larger vision to respond to climate change through specific interlinked sectoral missions. The program is focused on reducing the health impacts of climate change on the population, especially vulnerable groups like children, women, and marginalized communities. Its goal is to reduce morbidity, mortality, injuries, and health vulnerability to climate and extreme weather. So we can go to the next slide, please. And we want to acknowledge all these incredible submissions we received, and we hope that those who contributed can watch this presentation today. I was so moved by receiving this media that we got from the folks out here, many who we don't know who are in our networks. And our group sat for many hours kind of thinking about these and really trying to feel into it. A lot of really powerful images. And I'd just sort of like to ask Gora, Michelle, and Gina kind of what your reactions were as we were going through these photos and these stories and these poems. How did these make you feel? And what do you surmise from these submissions?
I can go. I think we as nurses, physicians, anyone in our healthcare profession, we collectively have a very unique eye into our patients and our families and what they experience. And seeing this and seeing these submissions from around the world really helps us as providers in those roles to take better care of our patients. It encourages us to seek solutions and to help them in ways, any way that we are able to do so.
So I think these images and these poems and just hearing globally from healthcare professionals, it really highlighted to me how, although as healthcare professionals, we think so much about our patients, we're really, caring and dedicated, and we want our patients to be healthy. And I think it's important to kind of take a step back and also reflect on the fact that as healthcare professionals, we're people too, and we're humans too. And I think these really showed a lot of the kind of raw emotion and feeling that many of our healthcare professionals have related to climate change and health. And so it kind of highlights why it's so important that we are all still in this together. So we all have these feelings, but we really need to kind of band together to have a hopeful future.
Yeah, I think there's this yearning, I think, in a lot of them of navigating, I think, what the conversation today is about: hope and despair and creating a new world, and a loss of home, building new home. And so I think health is a moral compass for us. There's a raw humanity that we're connected to. And I think that came out in the art, and a mix of pain and possibility and imagination.
Okay, well, we have one more submission to share with you. So if you could go to the next slide, please. And Gina, if you want to tell us a little bit about this.
Sure. So we heard from the perspective of healthcare professionals, and the voice that is not present in the room oftentimes is the voice of our patient and the voice of children. And so what you can see up here and also in the back of the room, they are posted on the wall immediately in the back. Zarina Tompkins is a nurse from Australia. She is also the mother of an 8-year-old daughter who, with the help of her teacher and her fellow second grade classmates, created these drawings to share with us here at COP. These are the drawings of 8-year-olds, and you can see here many images of brilliance. You can see that the children, along with us, are noticing climate. In many cases, they are begging us to partner with them to leave them a healthier world. And I would like if you can go to the next slide. This one spoke to me. It's a picture of a globe and a faucet and a water drop. But what I didn't initially notice when I looked at the drawing is there are 2 hands at the bottom right-hand side of the drawing, and they are holding that water drop. I also like this one. It is a volcano, and if you can see, if you look closely, those are hearts coming out of the volcano on the left-hand side of the screen. On the right-hand side of the screen is another picture of our world. It's being held up by a hand, and I thought that was really special and really telling. It says, "Save planet Earth with care." So if you would like to look at the photos a little bit more in depth, they're in the back of the room, and they're really beautiful. And I think we can all agree from the video that we saw from Nightingale, in these drawings, in these paintings, in the poems that we have been, they're quite impactful. And as much as they cause each of us to pause at the insight presented here, I remain hopeful and motivated by the work that we are all doing here at COP, that we do in our daily lives, and that we do in our professional roles each day, that our collective voice and our meaningful actions will bring a tide of change. And that is sort of our hope for this project, that we were able to help you to see what other healthcare professionals might be feeling, what you might be feeling. And we wanted to bring that here to you today. And we thank you for coming.
Thank you. Thank you to all of you for being here, and to our submitters. Have a great day.